Lynn Deary from St. Louis, Missouri.
Lynn came to see us because she had shingles, and then she later on developed postherpetic neuralgia of her face. Now in her case, the symptoms were primarily in the cheek and in the nose and the upper lip, and also inside the nose. That would most likely be the anterior superior alveolar nerve. The reason I was familiar with it is because Dr. Dellon and I and a few of our colleagues wrote the only paper in the medical literature specifically looking at the anatomy of that nerve.
Oh my goodness. Whew. My primary, first pain specialist, and then another pain specialist. Oh, I went to a pain psychologist to try to deal with the psychological aspects of chronic pain. Low-level laser, homeopathic guy, the infusion people, and I it's more than probably on 10 fingers. I didn't want to go out and do anything. I was much more of a hermit. It significantly impacted my quality of life. So we found him two ways. My husband is really bright and anyway was doing a lot of research, so we found him through the research that my husband was doing. But then we also found him, I'm on a Postherpetic Neuralgia group on Facebook, and so we found Dr. Aguila also through that. I think there are very, very, very few other people who do this. So that's number one. And then second, when I met him, he's got a tremendous bedside manner. And he just made me feel so comfortable. And I knew I trusted him just from the first meeting.
We did an injection of the infraorbital nerve. A lot of the pain in her cheek got better, but she still had pain here in her nose. I said, okay, let's go after the infratrochlear nerve. So we did that injection. And the pain here toward the top of her nose got better, but not down low and not the pain inside her nose. So I said, let's go after the anterior superior alveolar nerve. So I did an injection inside the nose. And she said, Doc, the pain inside my nose is gone. But I still have this pain right here. Now, the pain she was describing right here, my suspicion was that it was coming from a nerve that, number one, not everybody has. And number two, you'll have a hard time finding in most anatomy books. It's sometimes called the lateral nasal branch of the anterior ethmoid nerve. We did an injection there, and she said, Doc, that was it. That was the spot we're looking for. Made an incision starting here under the eyebrow, going down here along the inside of the eye and the side of the nose, all the way down here down to just outside her nostril. It's a pretty long incision. Thankfully, it's one that I was really familiar with because I've done a lot of facial reconstruction in the course of my training and my experience. As an ear, nose, and throat surgeon, we did tons and tons of facial reconstruction like this. When I was in Afghanistan, I did tons of facial reconstruction like this. As a plastic and reconstructive surgeon, I did tons of facial reconstruction like this. And of course, as a peripheral nerve surgeon, I was taught to pay attention to the nerves in all the areas of the body that we operate on. We found the supraorbital nerve. We found the supratrochlear nerve. We found the infraorbital nerve down here. We found the infratrochlear nerve. We found the anterior superior alveolar nerve. And thankfully, we found the lateral nasal branch of the anterior ethmoid nerve. And we disconnected every single one of them.
Already the pain is so much less than before the surgery. Get back in touch with friends and start doing more social activities.